Generally, interventional radiology procedures are, I keep stressing this, they're convenient for patients. These patients are not under anesthesia. They're generally awake. They're in an advanced image guided suite on a bed, comfortable. Most of the patients are mildly sedated, and once we give a small injection for local anesthesia, the patients don't feel anything throughout the procedure. And post-procedurally also, if you see, the recovery is quite fast. If we access the blood vessels, we generally ask them to stay in bed for about anywhere between 2 to 6 hours, where they stay in our daycare suite, or where they can stay in a daycare room, and then the patients are discharged the same day in most of the treatments that we do. Some of the treatments might require an overnight stay or maybe a stay of a few days for observation. So that might be required. And the recovery is generally quite fast. Most patients get back to their daily activities within 3 to 4 days. Some might take a little longer. So in general, these procedures are very safe compared to surgery. So because of the minimally invasive nature, patients who are generally unfit for anesthesia and for surgery, or with diabetes who might have prolonged recovery after surgery, these kind of patients are the ideal candidates for interventional radiology procedures, because again, there's no anesthesia, or if they're on blood thinners, some of these patients who are on blood thinners for their heart conditions, they don't need to stop their blood thinners when they undergo interventional radiology procedures, whereas with any surgical procedure, they will have to stop them. So that is one more advantage. So the geriatric age population, or patients above the age of 80 or also above the age of 70, 75, these patients are ideal candidates for interventional radiology because of the lack of the risk factors that come with traditional surgeries. We have a couple of challenges. So one of the biggest misconception that people might have is because they have not heard of these procedures before, they think that these are new or experimental. And I'd like to categorically state that these procedures are well established in the Western world. They've been widely evidence-based and research-based, proven therapies which are all FDA approved, and the number of the patients undergoing these procedures in the Western world is very high compared to what happens in India because of the lack of awareness. And also, when people are aware, they think that this is something new, and sometimes because of some miscommunication or lack of proper understanding of the results from these procedures, patients might still opt for traditional surgeries when they're actually candidates for minimally invasive therapies. So that is the biggest misconception that still people have. It's about the effectiveness of these procedures. And also another small misconception that happens is because we use imaging like fluoroscopy or X-ray, the same technology that is being used for delivering heart stents, it's called fluoroscopy, and it's done in a cath lab. So some patients have a misconception that there is a lot of radiation involved in these procedures, but with advanced imaging solutions and AI-based technologies that have come in, the amount of radiation that happens because of these procedures has been drastically reduced and is extremely safe when you look at compared to the traditional technologies that were being used before. So it has been well proven that the radiation X-ray exposure that can happen during some of these procedures is extremely low and is probably not going to affect any of these patients, or most of these patients that undergo these procedures.